Does ejaculating more lower your risk of prostate cancer? This is an important topic. I'm going to give you the answer. Guys, I'm Dr. Jen Caudle. Let's start. But first, let me tell you a little bit about prostate cancer because you need to know this. First of all, 1 in 8 men in the United States will be diagnosed with prostate cancer. Now that's huge, okay? Not only that, 1 in 44 men will die from prostate cancer in the United States. And prostate cancer is the second leading cause of cancer deaths in America. This is second to lung cancer. By the way, let me tell you, I have a number of men and have had a number of men in my family who have or have had prostate cancer. This is really near and dear to my heart. Now, you may be wondering, well, who's more likely to get prostate cancer? What are some of the risk factors? Well, if you're over the age of 65, you have a greater risk of having prostate cancer than, say, if you are younger than 40. Age is a risk factor. Also, we know that in terms of race and genetics, I told you about my family, but we know that African American men are at higher risk than other groups for getting prostate cancer. And Caribbean men that are of African descent are also at higher risk as well. Other risk factors include things like family history and certain gene changes, etc. By the way, I have a whole video on prostate cancer. I will make sure I link that here, so check that out. But let's go back to this ejaculation question. Is it true, or can it be, that ejaculation could lower your prostate cancer risk? Well, let me tell you, there's a study done in 2016. This was a study, a big study, 32,000 men that were followed for 18 years. Kind of a big deal. This study found, for one, that men who ejaculated at least 21 times per month, which is a lot, but 21 times per month had a 20% lower risk of getting prostate cancer than men who ejaculated only 4 to 7 times per month. And this is for men, by the way, in their 20s and in their 40s. Now, let me say, when we talk about ejaculation, you may be saying, well, what are we talking about? Are we talking about masturbation? Are we talking about sex? Well, just ejaculation, however it's done, okay? But let me tell you, that finding of men who ejaculated more having a lower prostate cancer risk, that finding has been duplicated in other studies. There have been other studies that have shown similar findings, okay? Now, I will also say that there have been some studies that did not find those findings, okay? So we always have to sort of weigh and balance and sort of give the full picture. There have been a decent number of studies that have shown this connection, this sort of link, but not every study has. Now let's go back, though, to this idea of ejaculating more, potentially leading to a lower prostate cancer risk. Well, why could that happen? Well, one hypothesis is that maybe greater ejaculation, more ejaculation, allows for a greater flushing out of potentially harmful chemicals, which could potentially benefit a man and lower their prostate cancer risk. Another potential theory is that, maybe it's not that at all. What if men who can simply ejaculate more are healthier? And maybe it's the fact that they are healthier that allows them to have a lower prostate cancer risk. You see the potential questions that there are, right? So what's the bottom line here? Yeah, we do need more research, right? Because we need to know for a slam dunk to be 100% sure that more ejaculation means a lower prostate cancer risk. But there are, as I mentioned, some studies that do show this link. What I would say is that for many men, ejaculation is probably not a bad thing, okay? There are benefits to sexual encounters, the intimacy, the mental health aspects that many people feel. There are benefits to masturbation as well. So I'm here to tell you that, if ejaculation is on your mind, well, it's probably not a bad thing or a harmful thing. Could it actually lower your risk of prostate cancer? Yes, it could, but we do need more data. We do need more studies. We do need sort of more of a slam dunk, and there are some variables that could be sort of at play that we haven't fully elucidated yet, but ejaculating more for most people is probably not going to be a problem if that's what you choose to do, in hopes that it may lower your prostate cancer risk. Guys and gals, let me know what you think about this study. Write in the comments, share this video with other people. Let me know what you think. Subscribe to my channel, click the little bell for updates. Follow me on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp, everywhere. Follow me there and go to my website, drjencaudle.com, to sign up for my free health newsletter. All right, guys. Bye.